Congratulations, you had a successful m.o.i.s.t therapy today. And m.o.i.s.t, as you know, is an acronym for a proprietary technique that I've developed over decades of seeing thousands of patients from all over the world, patients of all kinds of complexities and severities of dry eyes, even patients who've had multiple failed treatments and technologies for dry eyes anywhere in the country or world. m.o.i.s.t acronym stands for meibomian gland recanalization. O stands for osmolarity correction. The I stands for intracanalicular lacrimal gel slugs. And then you have the surface stabilization. And finally, the tear film restoration. So all of that is achieved by this process that I've come together to put as a m.o.i.s.t therapy. And m.o.i.s.t, as you know, has different levels of applications. So it goes from 1 even up to level 6 to 8 based on the severity of your case if I have to do something, even in staged fashion. Now, most people do very well at m.o.i.s.t at the level of 3 and 4, where I go ahead and restore their tear cycle, their own natural tears, at all the 3 levels that I've described in my previous videos and presentations for you. So today, since you've had a successful m.o.i.s.t therapy, you've been provided with the m.o.i.s.t therapy kit, which looks like this, right? And it has 3 components in it. This kit was actually arranged by us for our patients who come from, don't go back to their states or countries and use different products, and they use something that I believe in to maximize the success of your m.o.i.s.t therapy. So in this kit, there are 3 items. The most important item is the eye mask that you see here. This is extremely important because having released your oils in your eye now through your meibomian glands, I want that oil to become less sticky, right? Remember, I call it toothpaste. It should become more like olive oil. So it flows and it's usable, so it helps you protect your tear film. So this mask you can microwave for about 30 seconds in a normal microwave. Place it on your eyes like this for about 10 minutes. Make sure it doesn't burn you or something. It's warm enough, yet not too hot. And use it for 10 minutes. Use it twice a day if you can, please. The regimen I like is you have a special formulated medication eye drop bottle that contains medication that also helps your tear film layer, the innermost mucin layer, right? It helps get that layer back and decrease inflammation while you're healing through this. So I always want the warm compresses first, followed by that medication drop. This way the drop has maximum penetration and gets to the area and is most effective it can. So your regimen, remember, is morning, you will use the warm compresses for 10 minutes, then follow up with that formulated medication eye drop bottle. Same at bedtime, so twice a day. All right, the medication drops will finish at 2 weeks, but the warm compress I want you to do for life as part of your eye hygiene. Just like when you go for teeth cleaning, right? You do the hygiene part. And I really believe in this because I believe my success has been because the patient's involvement in taking care of the ocular hygiene. Because I'm not doing anything or giving you any foreign drops. This is all about your own tear film cycle getting maximized. Treat the problem. So that's why this mask is very important. The second thing you have in your box is gel. Basically, take a little bit on your finger, like so, make a little bead out of it, right? And then put that on your lower lid and rub the lids. Think in your mind that you're rubbing away scruff, if you may. I know it sounds horrible, but that's what it is. Now that I've opened up your glands in the lids, you want to make sure it doesn't clog. So you clean that out, especially if you're using makeup or mascara or something which you're already removing nicely. This is once a weekend is all I want. Just once a weekend. It could be a Saturday. All right? And then finally you have drops here, which also I like because it's of balanced nature and the pH content. Also the comfort and the fact that its overall milieu of the drop is very, very, what you call, compatible with the ocular surface. Use that twice a day. So what you would do, again, warm compresses. So in the morning, you will use the warm compressor about 10 minutes, followed by your medication eye drop bottle that you have received here. Then you will proceed at night and do the same regimen. Once a weekend, which could be a Saturday, you'll use the gel to clean your lids. All right, and you can wash it with water. It's not toxic. And then you will use this particular artificial tears twice a day. And you can even keep that refrigerated. So that's the full hygiene I want you to do with the m.o.i.s.t therapy kit that you have. And that way it remains a uniform treatment that you're doing to maximize the work that I've done for you. Because remember, I've given you back your own natural tear cycle. I want you to maintain it, especially because I have seen the success while I did your m.o.i.s.t therapy. I saw the oils. I know you have the capacity. So please do that for me. All right, that's very important. Maintain your regimen. Of course, my staff is here. You can call us anytime. My staff or me, I'm always available to you to answer any questions you have, and wish you the very best. Thank you.